Hi there all, my name is Ben Lang. I'm one of the Dell Children's Emergency Medicine Fellows in Austin, Texas, and I'm working on a project with Dr. Annabel Cramer and Dr. Kate Remick entitled The Uptake of Bereavement Principles Among a Diverse Cohort of EMS Providers Using the COPE Curriculum, a simulations-based approach. Thanks for coming to listen to this today. The background of this is that in the past, it was often the teaching that the focus in out-of-hospital cardiac arrest in pediatric patients should be scoop and run to try to get patients to the hospital as quickly as possible. Now, with new data showing that there is increased mortality and morbidity benefit from high-quality CPR in the field, the movement has been in recommendations to pursue as much high-quality CPR in the field as possible, and therefore also increase the frequency of termination of resuscitation of pediatric patients in the field. In interviews with families who have undergone this, they feel like they have wanted more communication from pre-hospital providers than they have received. And in interviews with pre-hospital providers, they have felt like they wanted more education on how to be able to balance the medical needs while also being able to communicate to the family. To be able to work on both of these problems, a team led by Mary Fallett in the University of Kentucky in 2016 designed a curriculum using elements of interviews with both families and paramedics on what pieces needed to be included. They designed a curriculum that included information about how to improve communication with families. And this was part of an EMSC Targeted Issues grant. And they tested this curriculum through simulation-based curriculum, and it showed that it improved communication skills and self-insight of those paramedics who were in the simulation, as well as that paramedics felt that it was extremely helpful. 90% said they would recommend the curriculum to colleagues, and 2/3 of them wanted that app to be publicly available, as they felt like it would improve communication with both pediatric and adult termination of care. So our objectives is really to use that study as a jumping off point to be able to take this curriculum to test whether it works in both paramedics and EMTs, as well as a diverse rural to urban setting in Central Texas. So specifically, we're looking at whether it increases provider comfort with the communication of pediatric death, whether there are other variables that help this curriculum to be more helpful on the provider side, and then to be able to determine if there's any discrepancy between what the providers feel that they're doing well versus what an observer would say. The way we'll be doing this is recruiting from 3 counties in Central Texas that are all in both rural and urban settings to be able to perform continuing education with first responders of all levels, whether that's EMT to paramedic, novice to very experienced providers. We will be gathering some data on those providers and then leading them through the curriculum using the newly designed COPE web app, which includes videos and information about how to improve communication. After this, the pre-hospital providers will participate in simulations in which they will get to practice their skills. And then afterwards, they will assess their skills as well as assess their comfort with this. This is just an example of the app that we're using, some of the videos that are included on it, and then a still from one of our recorded sessions in which the paramedics are discussing the death of the infant with a parent. The results that we're looking for is to figure out if they have increased comfort before and after, to be able to use validated assessments of communication to see if that is improved, and then to see if this is something that they would like to use in the future. Thus far, our outcomes have primarily, in the simulations, really shown that these medics have a lot of important things that they want to talk about in terms of the psychological effects of death in their careers. And so we've also been engaging the help of a local mental health trauma counselor to be able to help deal with the secondary trauma that this curriculum brings up. And those people who have participated have been very excited and want to be involved and disseminate this information to other locations. I want to thank all of the original COPE team. Here's some of our references, and feel free to contact us at any time. Thank you so much.